All right. So I just want to give an introduction first. This is Dr. Marta Di Forti. She's with us from the Royal College of London, and she is one of the leading researchers in the field of cannabis and psychosis. She's published the first evidence that high potency cannabis carries more risk than traditional forms, and also that high potency cannabis use and daily use of cannabis impacts the rate of psychotic disorders among 11 European sites. And she's also started the first ever cannabis clinic for patients with psychosis in the United Kingdom, which is impacting the lives of a lot of young adults who experience psychosis in context to heavy cannabis use. And we wanted to bring her out today because in our community, obviously, we have a lot of cannabis dispensaries and we have smoke shops on every corner. And so this is something a lot of our kids have easy access to. So we wanted to have her come and speak. And since she has limited time, I would love her to introduce herself and tell us some more about her research.
Thank you very much for having me. So I might sort of share my screen so you can see um, my slides. Allow to share window, and then please tell me if you can actually see what I have. Can you actually see my slides?
I I don't see a slide. I think it's coming. Or says you're sharing a screen. It says you're sharing the screen, but
But you don't see my screen because my screen should be. Do you see what do you see? Do you see me?
I see you. Yeah.
Okay, that's not very helpful. Okay, let me see. Let me try again because it says to me stop sharing your screen. Well, okay, well, start again. Optimize images, text, no, share, continue, allow to share screen. It's saying connected. So okay, while we try to share the screen, I think he looks like he's doing it. What can you see? Can you see my screen now?
No, no.
I think you do because I think I can see you
You
seeing.
can see me. Okay, now we see your slide.
Okay, brilliant. Let me put them in presentation mode. I could see your daughter in the background coming to the rescue, but I think we did it.
It's
So can you
recording.
see my screen now?
We see it.
Brilliant. Now, unfortunately, I can't see you, but I know you're there. So before I start, I just wanted to say, please feel free to interrupt me anytime if you want to comment, bring up some experience, or you have a particular question, because I have some slides, but I would really like to cover what is really relevant to you rather than what I thought it might be relevant to you. So no problem with interrupting me. So my interest in the link between cannabis use and psychosis really comes from my clinical experience. So almost now, sad to say, 20 years ago, I had to choose a topic for my PhD. I was completing my training as a resident in psychiatry, and I had moved from one hospital in London to where I work now. And where I was before, it never crossed my mind. And we are talking here would be 2008, 2006, 2008. It would have never crossed my mind that cannabis had anything to do with psychosis. There was not much to talk about it. In your training as a psychiatrist, it was not really mentioned as a substance of concern. All the training we had was about alcohol, opiates, stimulants, and so on. But when I moved to Southeast London, it became quite common for me to see young adults, 18, early 20s, developing psychosis for the first time and reporting having used cannabis before the onset of the psychosis. But even more importantly, parents would come to me and say, well, my son was actually doing quite well until he started use cannabis, and particularly when he started using regularly. And at the same time, there were beginning to be from Europe some of the first study in research pointing at the link between cannabis use and psychosis. So I decided to do my PhD exploring a little bit more this topic. And this was really because And this is actually a cartoon that's been created by people under my care. I was seeing these young people, particularly young male, who had been using cannabis initially socially, then they started using more regularly, predominantly daily, who would begin to report feeling unsafe when out and about, having a perception that the environment was no longer friendly or neutral, but on the contrary, was sort of hostile, referring to them. So people would be, they felt that people were looking at them, and they were not just looking at them coincidentally, they were actually looking at them because they wanted to cause them harm. They felt people were following them. If they did go to a television shop, as you see in the example, they felt that the television program was referring to them and broadcasting their life. And of course, they start becoming more and more withdrawal. So tending to spend most of the time in their flats rather than outside. But then even the flat started becoming an unsafe environment because they would begin to feel that the neighbors were surveilling them, spying them, and put a microchip under the floorboard. Again, that the television was talking to them and broadcasting their thoughts. And as you can see in the picture with the brain on fire, they felt that their brain was transparent and that people could access what they were thinking. So these are very terrifying experiences. They have a huge impact on the ability to function. You can imagine if you feel that people are out to get you, you stop going to the local shop to buy food, you stop going to school or to university or to work if that's what you were doing until then. You begin to withdraw also from your loved ones. Many of the people under my care begin to think that the food that, if they live with their family, that is prepared for them might be poisoned. So this has got a huge impact on the overall ability to function and causes a huge amount of distress. And there's been research that has translated this cartoon that represent personal lived experience into data. This is actually a study, actually the study is the next one, sorry. This is a study from one of my former PhD students, a psychiatrist as well. And he compared young adults who develop a psychotic disorder for the first time. So here we're talking about those experiences that I just shared with you from the cartoon, which are at a degree that you need actually care from mental health services, either in the community or in the inpatient. And he compared people who came to the first episode of psychosis because of the cannabis use with the one that never used cannabis. And what he was able to show is that the one that had come to psychosis by the cannabis use, they presented exactly the symptoms I was describing to you, but much more severe than the other group and very intrusive. And they were more likely to be admitted to hospital, and they were more likely to be admitted against their will. So what we would call in UK a compulsory admission. And if we go back to the previous slide, I don't know how many of you are familiar with the literature linking cannabis use with psychotic disorder. This is by all means is not a new literature. We now have 3 meta-analyses, which in research are the gold standard that summarizes all the studies that have been published to date. And this has been done 3 times. And consistently, the first 2 meta-analyses show that if you have been using cannabis at some point in your lifetime, most of the time starting in adolescence, which is when the majority of people begin to experiment with cannabis, you double your risk of developing a psychotic disorder. But the last meta-analysis, which is this colorful graph I'm showing you, did something a little bit more sophisticated. Now, usually when I'm giving this talk and I'm in a room with people, I would say to the audience, if I ask you the question, how many of you have ever drunk alcohol? Can you put your hand up if the answer is yes? I've never been in an audience where 80% of people would not put a hand up saying yes, including myself. And I actually drink very little because I become sick if I drink. But even I would put my hand up. But the bottom line is that asking a question, have you ever drunk alcohol, yes or no, in your lifetime? And people saying yes, tells me nothing about the risk, for instance, of develop liver complaints, liver disease. It is the same for cannabis. If you just ask people, have you used cannabis, yes or no? Yes, you might get enough data to be able to pick up a doubling in the risk, but you're really not capturing the people who are engaging in a really harmful pattern of use. And so in this study, one of my colleagues was able to use available data on the amount of cannabis consumed. And this is what you see here on the horizontal axis where it says cannabis exposure. And what he did is that for each of the study, he looked how the increase in the amount people consumed was associated with increase in the probability of developing a psychotic disorder. And as you can see for all the studies, this study actually has very little cannabis consumption. But you can see that for all the study, greater is the consumption, greater is the risk of developing a psychotic disorder. This red line represents my catchment area, represents the area where I work as a clinician, where not only there is lots of cannabis use, but is more likely to be on daily basis and is more likely to be of high potency strain. And you can see how this has a huge impact compared to the other study on the amount of probability and risk for psychotic disorder. But overall, what was interesting is that the summary increase in risk was of 4 times. So already having very little data on the amount that people were using brought us from an overall doubling in risk to a quadrupling in risk. Now, if you look at the literature on psychotic disorder, there are other risk factors for psychosis. By all means, cannabis is not the only risk factor for psychotic disorder. Psychotic disorder are a multifactorial condition. They have genetic contribution and lots of other environmental contribution. But you can't reverse obstetric complication. If your child has had obstetric complication at birth, as happened, you can reverse it. If you have been a victim of sexual or physical abuse, you can receive psychological intervention, but you can't cancel it out. You can decide to stop using cannabis or change the way you use it, the amount you use. So cannabis use has a huge impact on the risk of psychotic disorder and is modifiable, which I think is a very important message. Did I hear an attempt to say something?
I was just going to ask,
Of
what is
course.
high potency cannabis? What does that mean?
So, first of all, the consensus on the definition of potency is that we measure to date the potency on cannabis, measuring the amount of THC. So in cannabis, we know there are at least 144 active ingredients that have been identified. And also there are other substances called terpenes. They are responsible for the smell, the taste, and so on. Of these 144 active ingredients that we are learning about, what we know the most is about THC, delta-9 tetrahydrocannabinol. And so at the moment, we measure the potency of cannabis based on the THC because we know from lots of experimental study that is THC that is responsible for the high, that is THC that is more likely to drive the dependence, so how likely people are to become dependent on it. And we definitely do know that it's THC that is associated with the development of transient psychotic symptoms, if it's just an intoxication, a one-off intoxication, or when there is a regular use, the risk actually of developing the clinical disorder. For high potency, it's quite interesting because the study I've done so far, and we were the first one to have data on potency, so that's why we did the first study. We were looking really at a cannabis where the high level of THC was around 16% on average. So we felt, wow,
Was that
16%.
16, like 1/6?
1/6, yes. And this was my first study, and I thought, wow, that's very high. I know that compared to what you see in the States, this is really pathetic. But it's quite interesting to think that the first evidence, considering high potency around 16%, 1/6, were very conservative compared to what people are exposed today, particularly in the US. And the
Yeah.
study I'm showing you this picture of is even more conservative. Here, the cutoff that separates high potency from low potency is 10% THC. So this is very important because if 10% THC, it's enough to increase people risk, and this is what's happening in London, this is the first green bar, the risk of developing a psychotic disorder of 5 times, and in Amsterdam of 9 times, and in Paris of 4.8 times. Even when you take into account any other drugs that people might be using and social demographic factor associated with psychosis, we can just speculate what happens if the THC you have in your cannabis is 60, 70, 80, 90. And we don't have enough data to actually measure that impact, but we know that even 10% is either good or bad enough, depending how you see it, to induce a psychotic disorder, which again is not transient. These are people that come to the attention of psychiatric services. I don't know if that's helpful.
We have a question here too.
Of course.
But thank you for your presentation. My question is, cannabis that's available in the market, can you specify what THC level you can get, or what's the standard, potency of THC that's available in the market?
Thank you very much for the question. So that depends where you are. So for instance, in UK, where I live and work, it's still illegal for recreational use. So people would buy cannabis from drug dealer, and in general, they had no idea what's in it. You find we have some data that come from the government who has analyzed samples seized by the police in personal searches or big seizure. And so I've been part of one of these studies. We have an idea, depending what you buy, what is the average potency. And in London, is still around 14-16% on average for the high potency. And then we had until recently hashish resin type around 4 to 5%, but that's pretty much disappeared. In Colorado, for instance, you have type of cannabis that go up to like shutter, that go up to 60, 70, 80% of THC. In Canada, there was an attempt when cannabis was legalized for recreational use to have a cap on potency, so that people will go in a shop and they would not find a type of cannabis greater than 20%. This is no longer the case. You can find type of cannabis around 30, 40, 50, 60%. So it really depends where you are. And if it is legal where you are, you should have information when you buy a cannabis product on the percentage of THC, which is the potency. But there have been some studies in California in dispensary where they have analyzed what really is in the cannabis and what people say is in the cannabis, and there have been some mismatch in both directions. So some product claiming to have very high percentage of THC and it was much less, and vice versa. So it really depends how regulated the market is where you are, and I would say how honest people are on what they say. And actually how much the government is really regulating it. So for instance, in the Netherlands, in Europe, they the government publishes every year a document which comes from the analysis of all the products that are sold in coffee shop, which are the places where you can legally smoke cannabis. So in the Netherlands, you can't go around in the street and smoke cannabis. That's illegal. But if you are in a coffee shop, you can smoke illegally. And coffee shop will have a menu which gives you the name and gives you the percentage of THC, and also the other famous cannabis active ingredient, which is CBD, cannabidiol. And that usually is a reliable estimate because they're very strict controls from the government.
So what level of THC does not trigger a psychotic disorder? Because in Arizona, it's legal to use cannabis. So in general, what level of THC is acceptable?
Well, the study we have done are indicating that anything above 10% of THC already puts you in a risk position. But I would also like to say that we are not talking about something that is the same for everybody. So there are, by all means, people out there who might even be dependent on cannabis, but have not developed a psychotic disorder. There are people who are using more than 10% in their THC, even every day, and they've not developed a psychotic disorder. It is not a 100% association. The problem is that we haven't yet worked out a screening system that can tell us this person, if they use this potency of cannabis, they are 100% likely to develop a psychotic disorder, when this person can use also 60% and they'd be absolutely fine for the rest of their life. We're not there yet. But I will also say, give you an analogy. You're all familiar that, again, drinking heavily alcohol can increase the risk of liver disease. But you would also know that there are in the history very famous people that will say that they have been drinking very heavily all their life and they lived until age 90 and they did very well. You would always hear of people that say that they smoked cigarettes all their life and they lived and never got lung cancer and they died in the late 90s. So when you think about complex diseases, there is a huge variability in individual propensity, in this case, to develop psychosis when using cannabis. So I can't say to you, if you use below 10%, you're absolutely safe. If you use above 10%, 100% you're going to get psychosis. It's really an issue of probability, if you like. I don't know if that makes sense.
Got it. Thank you.
And sorry.
Go ahead if you have.
Sorry, I can't hear. I don't know if there was another question. I couldn't hear very well.
Can you hear now?
The sound is not very very clear, so I can hear your voice, but I can't really understand what you say. I'm sorry about that.
What's your question?
I wanted to ask her, lately I read that some cannabis can have problems like maybe fungus and something that can make you sick.
She was saying she's
Yes,
read.
I got the question clearly
Okay.
now. Thank you very much. Yes, by all means, if you get your cannabis from a non-reputable source, it can be contaminated with fungi, with pesticides, with heavy metals, and that's going to add to the hazard. But these are not the elements that have anything to do with psychosis. They might make you sick. They might give you an infection. They might give you a respiratory problem. We have lots of studies that have been done in a lab where people have been given pure THC, very, very well prepared and without any contamination, and they have induced psychosis. We have people who have been using cannabis that has been grown under very controlled condition and they have developed psychosis. So when you think about the link between cannabis and psychosis, because people sometimes disraise it with me, it is not to do with fungal contamination or pesticides or heavy metal. These things will add up to the harmful effect, but it is actually the THC, and we know that from several experimental design where healthy volunteers have been given in a lab pure THC, and you could actually within half an hour induce in them psychotic symptoms. So that will not explain this association. It's a little bit like thinking about alcohol. There are people that might produce their own beer, and it might be a very good beer, but depending how they've done it, there might be more sort of chances of contamination that if something has gone through a very clear and controlled process. But either that you drink a contaminated beer or non-contaminated beer, the alcohol in it will make you drunk. Then you might also get upset tummy, but the effect of the alcohol in it would be the same. At least in terms of your sort of, if you like, central nervous system, so at the neurological level.
Thank you.
Pleasure, thank you.
I think the pesticides have a bigger effect. However,
I'm sorry, I did not hear the question.
I think somebody was saying that she just thought that maybe the pesticides had more of an effect if the plant is grown indoors or outdoors.
however, I wonder, I have a question. Can we ask questions?
Yeah, come on up.
So my question is, where are the participants from the study? And do they have pre-existing conditions? And
Did you hear that question, Marta? So she was
I
asking.
had only yeah, you go.
Okay.
You tell me, please.
She was asking where your study participants are from and if they have any pre-existing conditions like mental health or.
Yeah, that's a very good question. So first of all, my studies by all means are not the only, they are one of many. So our participants, the one of the study I did, the one you saw, come from 11 sites across 7 European countries. So it's a multi-center study. And no, they didn't have pre-existing condition. And not just in terms of psychosis. These were people that were developing a mental health problem for the first time. So by definition, they didn't have pre-existing mental health condition. And when we did our analysis, nevertheless, we took into account as when they were children, they might have had some difficulties at school, academically or socially. So what you might call in medicine prodrome. So some sign of, if you like, propensity to have mental health problem later in life. And even when you take into account this, which was a small group, you still have a link with psychosis following cannabis use. And what is actually very interesting, and this has been shown by several research, forget about mine, by very large longitudinal study of thousands of people follow up from birth up to the mid-20s when you expect psychosis to be more likely to develop, where they were able to carry out this type of analysis, excluding people who, say, in childhood or young or adolescence were having already some anxiety or low mood. And even in these very large studies, those who had used cannabis in adolescence were more likely to develop psychosis in their early 20s. But what I was going to say is, of course, if you already have a pre-existing mental health problem, and actually I will not answer entirely to this question now. I'll get back to you in a moment. But I often hear saying, well, but such and such, or my son, or even myself, I've been using cannabis because I suffer from anxiety, and when I use cannabis, cannabis chills me out. And then parents might say to me, and this is how my son started using cannabis, and so perhaps he would have developed psychosis anyway. It's just that his psychosis started under presenting as anxiety. He used cannabis to self-medicate, and then he developed full-blown psychosis. Well, first of all, there's no evidence whatsoever that cannabis is a treatment for anxiety. It is true that acutely you feel chilled. I would also dispute that when you have a glass of wine, you feel chilled. I hope none of us believes that prescribing alcohol is a reputable treatment for social anxiety. There are lots of studies that have shown that while a little amount of THC, given perhaps under control condition, like in some studies, can reduce acutely anxiety, anything in terms of more than 10% THC, and particularly anything that begins to be used every day, triggers a panic attack. So has exactly the opposite effect. So something also very important to consider with cannabis is that often there is a dose relationship. A little of it might make you feel chilled, might help you to go off to sleep. When you begin to increase the amount, you actually have the opposite effect. This has been shown for sleep, appetite, thermal regulation, and anxiety and depression. So it is very important to be clear that it's very different a little amount with an everyday chronic use of anything that is greater than 10% THC.
So then what you're saying is should have a balance. Right?
So she's saying you should moderate your use, is what she's
Yes,
asking.
and my advice is, what does moderate means? Because there are not yet enough data to give, like for alcohol, we're all familiar with units. We know there are differences between men and women by age, and this is not perfect, but at least it works at the general population level in terms of a marker of prevention. And, you can go to your physician and say, I've been drinking such and such amount of unit during the week over the last month, and your physician would be able to say, oh, well, this is a bit too much, this can increase your risk of liver problem of such and such. With cannabis, we are not there yet. So I would say, why are you using? So are you using medically? If you are using medicinal cannabis, you should do this with a physician, and with the help of your physician who is prescribing it, you should monitor the benefit against the side effect. As for any medication, I mean, any medication that we get prescribed is supposed to be beneficial effect. We also are made aware of side effect, and if these side effects have an onset, we seek help. We either change to an alternative or we get something to ameliorate side effect. But we need to be aware of it. We shouldn't just use thinking that, you know, is a plant and therefore is only going to be good for me. And then we need to be aware for ourselves what to look for. We all know how somebody drunk looks like. And sometimes, and I'm sure we all learned how we begin to change when we exceed our alcohol consumption. My concern as a psychiatrist is that very few people realize how their thinking process and their interpretation of reality is changing when they are beginning to experience psychosis. When you think your neighbor is against you because you are psychotic, you think it's true. And by the time you believe that your neighbor is against you, is almost too late. And so it's always important, if you are, for whatever reason, using cannabis regularly, and I hope it is only for medicinal reason, that you have somebody, for instance, a physician you can check with and say, and even do some questionnaire where you might ask yourself, has it happened that perhaps over the last couple of months, since I had to take cannabis for pain every day, I found myself being a bit more suspicious. I tend to check or change my password more often than I would do. I tend to wonder why people are looking at me when I go to the supermarket. And so, as long as people can do that and they realize there is a change, I think we can begin to say, yes, you should moderate. But unless we know what we're doing, it becomes difficult to moderate because you might actually don't know how cannabis is changing the way you see reality and your thinking process.
Marta, so you mentioned medical cannabis, and in Arizona and throughout most of the United States, that's kind of how we've commercialized it, is through the idea that it has all of these medical uses. But you said there is no like standard dosing, there's no standard percent or like way to calculate the percentage or the amount that you're getting. So how is it medical at that point? What would make it medical?
So I'm going to answer this question in 3 slides because I would like to, if that's okay, because I would like to complete the issue of potency because that's also very relevant to the medicinal cannabis. So we've been talking a lot about this THC, percentage of THC. Why do we care? Why should we care? Well, first of all, well, no, you don't want to worry about this. Cannabis potency, it's very relevant because these are data. And if you look at the graph with the red line and the green line, because the amount of THC contained in cannabis, either that is medical or that it is recreational, is being linked to the chances of becoming dependent on it. So these are data from the Netherlands, where I was saying to you, they're very, very sort of robust checks on the potency of the type of cannabis available to the population. And you can see that with an increase in the red line, which is the one indicating an increase in the potency of the type of cannabis available, you see an increase, a sharp increase in people seeking help for cannabis dependence. And this is important because there are lots of medication which we prescribe legally in medicine, opiates, and you know this in the States with all the opiates crisis, benzodiazepine, that by all means do have a place in medicine and can be very useful, but we also know that they can drive very severe dependence. And so it is important to be aware that this is the same for cannabis, particularly when you have high strains of a highly potent type of cannabis. But we do know that there are very clear now, there are not many of them yet, but there are very clear indication to prescribe cannabis as a medicine. But we need to be clear what we're talking about. So cannabis as a medicine should look like this box that you are seeing in the picture. So this is a cannabis medicine called Epidiolex, which is pure cannabidiol. So it's not a full plant extract like you get a little bit of an herbal a bunch of cannabis you put in your joint on your vaporizer and you smoke it throughout the day. This is not the way you prescribe cannabis for epilepsy. So the product that you have available under the reputable medicinal cannabis label is pure CBD. As you can see, it's got a very clear indication of the amount, 100 milligrams per milliliter. It is prescribed by neurologists. It is prescribed for particular kind of epilepsy to children who have very severe form. It is prescribed on top of regular epilepsy meds, so it's not the only medication that these children will get. And it has been, the CBD comes from a cannabis plant that has been grown by a pharmaceutical company under very controlled condition. So when the people under my care, some of my patients come to me and say, Dr. Marta, I have epilepsy. This is why I need to smoke my joint. I say, I'm sorry, this is not the way you use cannabis for epilepsy.
Mhm.
We now know that there are other conditions like multiple sclerosis where you can be prescribed cannabis product. Again, this is in UK a medication called Sativex, which comes as an oral mucosal spray. Like all medication, it looks like it's got its box, it's got its leaflet with all the information about it. It tells you exactly how much THC there is in it and how much CBD, how many spray you are going to use per day, depending from your condition, and your neurologist will tell you how much you need to use depending on which stage of your MS you are. You don't just go home and experiment with it. There are some pure THC products that have been prescribed for pain, particularly for rheumatic pain. And again, it would be the pain physician who will start with you a regime where you might start low and then you might have to increase, but you would do it being monitored for side effect, like you would do for any other medication. And the reason is, and this is an example that we were discussing earlier on that I often give, when we think about medication in medicine, and this is the aspirin has been declared the most prescribed medication in the world, and I always have in my mind when I come to the States and I go to any of your drugstore, you get these huge boxes tubes of aspirin that last you for almost a lifetime. So you be familiar, very familiar with aspirin. And, you know, aspirin has a very clear set of indication. You take aspirin for fever, for inflammation, for pain, for blood clots, for ischemic stroke. And so you don't you don't use aspirin randomly. You use it for very specific condition. But it does come with adverse effect. And again, you will look at the description of adverse effect and they will be very clearly spelled out. It can cause gastric bleeding, intracerebral hemorrhage, which is a very severe complication, skin swelling. And then, for instance, you should never give to children or adolescents aspirin for to control temperature if they have a fever, because in a proportion of children and adolescents, it can cause this very severe disease that can be lethal. So there are also groups to whom you never give aspirin. You might use paracetamol or alternative. And this is because there have been lots of studies to look at the indication. There have been randomized controlled trials where both side effects and beneficial effect, therapeutic effect have been tested, and also in a different ages group to look if some ages group are more sensitive to the negative effect than others. And then we have a specific dose. We know that if you're taking general aspirin as an anti-inflammatory or for the fever, you can use 300 or 325 milligrams. But for instance, if you are taking it as an anti-clot, you would use a different dose regime. And you know what aspirin interacts with, so you know that you should avoid other non-steroid anti-inflammatory. When it comes to cannabis, medicinal product, so first of all, as I mentioned before, what are we talking about? Are we talking the full plant extract? Are we talking about going to a dispensary and get a bit of fluffy herbal cannabis where we have it all in it? Are we talking about pure THC and pure CBD, like for some of the example of the medication I mentioned, like the Epidiolex, which is pure CBD? And which proportion of the two are we talking about in the context of the condition that people claim they can use medicinal cannabis for? So what do we know about adverse effect? We know that you can get transient psychosis, but we also know that, and it is very likely for people that take it for a prescription, they're more likely to take it every day. Most of the time when you take a medication for an ongoing condition, you take it every day. You don't take it only at the weekend, for instance. And so this would be a group that would need to be monitored. Certainly, you shouldn't give it to adolescents. I mean, unless you're talking about the pure CBD for epilepsy. You need to watch for your cognition. So depending which job you're doing, say your physician says that this particular THC pharmaceutical product is good for your pain, and that's the only pain relief you can get, you need to watch for your concentration, attention, and ability to function at work. You should be very careful about driving under its effect. With cannabis, this is difficult. Cannabis stays in the system for a very long time. It's not like alcohol. So if you are consuming cannabis every day, you need to consider if you are fit for driving, because it would affect your driving ability. There are, as I said, some clear indications that come from randomized control trial, which are the gold standard to see if something is an effective medication and where side effects have been monitored. And these are some of the examples I've already mentioned to you. I put schizophrenia, psychosis, CBD. Well, the evidence are a bit slim. We had hoped that CBD could help with psychosis, but actually it is not clear this is the case. There have been 3 trials and 2 have been negative, and we're not sure if this is because the dose was wrong. But the bottom line is that we don't have yet evidence to say that it can be used as a medicine for schizophrenia and psychosis. What we know is that it does not precipitate it, so it doesn't have the same effect as THC in increasing risk for psychosis. Sorry, I think somebody was about to ask something.
No, was it anybody?
Wait, so end the study, right?
Come forward so she can hear you. I don't know if the mic works that well, but
I will try to hear you. If I can't, I'll ask for help. I don't think I heard the question.
go ahead. Yeah.
Okay. Um,
Yeah. Do you want to just wait? We'll go ahead, Marta, and we'll catch up
Okay,
with her.
no problem at all.
Yeah, I'll ask a question. So Mark, sorry, this was about that slide on aspirin that you showed. You were showing a smaller dosage for anti blood clots, right?
You mean this one?
Yeah. So
Yeah.
75 or 81 for blood clots, is that correct?
Yes.
So how does that work? Because anytime you have an adverse effect, it is if you have a higher dosage or you've got, a continuous use of any kind of a medication for that matter, right? So when you this, isn't there a kind of a limit? Like if you are taking paracetamol or you're taking aspirin, let's say for a week, does that have an adverse effect? Like what is the time limit where you start to have a negative impact on the body? You understand where I'm getting at?
So I think I thank you very much for the question, first of all. So I think I understood most of it because I couldn't really hear all of it. So for aspirin, it's very easy to know, well, except for the brain hemorrhage where you might don't get any warning. But there are indications. I mean, you shouldn't, when you read the information on the aspirin leaflet, it will tell you not to take it for more than 5 consecutive days. So say you have a fever or you have pain, because you twisted your ankle, it would say not to use it for more than 5 consecutive days. But then also you would know, because you might start getting tummy pain, and you can also prevent, if you have to take it for a bit longer, the risk of gastric bleeding by taking higher dosage. To reduce your gastric secretion. So in some way you can limit, but with adding other medication, the risk of the gastric bleeding. But also you have clear indication on the leaflet or how long it is safe to use that dose by age. And this is exactly the point I'm trying to make about cannabis. You don't have that degree of knowledge yet. So we don't have enough information to say when you are consuming a product. Well, we do know for the one I mentioned, we do know for this, the pure CBD for epilepsy, you know, you would have a leaflet that would say that you had to monitor, for instance, liver enzyme, because a high doses CBD can cause damage to the liver. And so it will tell you how often you need to take a blood test to control your liver. It will tell you that you might experience sedation. And so you can keep an eye on that, especially if you have a child who needs to still go to school despite the epilepsy. For THC, for the Sativex, the one for the multiple sclerosis, it will give you the information on the leaflet. It will say you might experience psychosis. It will say that, you know, you need to you might experience changes in your cognition and you should be careful about driving. But in UK, at least, if you go to a dispensary and you get a bit of fluffy herbal cannabis, you don't get a leaflet with this indication.
Got it. Thank you so much.
Pleasure.
Marta, I know you're running out of time. I was hoping
No, we got a
you
bit
could-
of time still.
we got a bit of time. Okay,
Yes.
so finish this slide and then I'll ask my next question.
Yeah, so one thing I wanted to say, because it is not very well known, and when I say that, I don't mean to be patronizing and meaning that you don't know. Many physicians don't know this, but it's now been very well recognized that cannabis can cause dependence, as I mentioned before, and one of the criteria for dependence for any substance is that you have to have demonstrated that people, when they stop it, they experience withdrawal symptoms. Now, this is very important because sometimes when I speak to the people under my care, they say to me, oh, well, you say that I would be better off cannabis, but whenever I try to stop it or reduce it, I feel really bad. I get headache, nausea, anxiety, my anxiety gets worse, I feel all sweaty, I definitely can't sleep, and I don't eat as much. So, but if I start using cannabis again, then I feel better. This is not demonstrating therapeutic effect of cannabis. This is treating withdrawal symptoms. And I'm going to, and the other important thing about, because cannabis lingers a lot in the bloodstream, because cannabis, when people use it, is it reaches the bloodstream, and then some of it gets absorbed by the fat tissue, and then it continues to be released like a natural storage in our body. So if you stop cannabis on day 0, then you don't get immediately very distressing withdrawal symptoms. You might don't notice it and you think, okay, I'm not doing too badly without cannabis. But then you get hit by the severity of the withdrawal symptoms 4 to 6 days after you stopped, because that's when also your storage runs out. And this is why people find it difficult to link it to the cannabis use. Or they might go to the doctor and the doctor said, when did you stop? I said, oh, 6 days ago. Oh, no, it can't be the cannabis, must be something else. And so people are more likely to say, oh, that's because then I need the cannabis for sleeping well or controlling what I was trying to. And I'm going to get you to listen these from the words of somebody that's been under my care. So the gentleman is one of my young colleagues. So he's a senior resident in psychiatry, and Vanessa, who of course has agreed to have the video done for us and be shared, she's under my care.
Marta, there's no sound.
So I can hear it. So maybe it's something that you need to, let me see. Is there something you can do on your side of the system?
I can, let's see if we, let's, oh no, I don't want to do that. Still not,
Okay, don't worry.
Yeah.
It was just, I thought it would have been interesting for you to hear it from Vanessa, because Vanessa will say that she was using 7 grams of cannabis a day. That's a lot. And she then tried to stop, and she would get these very uncomfortable cramps in her stomach and feeling very sick, and would be unable to eat and would be unable to sleep for 2 days. And then she would start using again and finally get a bit of relieved. And she really struggled to see the link between her actually medicating a withdrawal rather than the cannabis actually having a primary beneficial effect on her sleep and on her appetite. And once she was able to abstain from cannabis for 3 weeks, and this is what you would hear if you could in this video, she would report that she was able to function better. She was able to go back and enroll in a course again, and her psychosis, because she was suffering from psychosis, significantly improved. But off you go with your question. Sorry.
Well, I wanted to talk briefly about just cannabis use across the life cycle, because now people are going to dispensaries, they're pregnant, and they say, I have nausea, and they're getting, I guess, prescribed cannabis or recommended cannabis. So if you can talk about just like over the stages of life, because I know you've talked about pregnancy, menopause, and adolescence being some prime times for psychosis symptoms to.
Yeah.
Yeah.
So what you say is very important, and this is something that profoundly worries me, particularly moms who are expecting a child. And because by all means, THC, and here we're talking about THC, pure THC, it's a very potent antiemetic. So it's very good for controlling nausea, but not in pregnancy. So for instance, THC to control nausea is recommended if you are doing chemotherapy. And I had cancer, now I fully recovered over 10 years ago now, and I was given drops of pure THC by my oncologist for the nausea. And he helped me tremendously because nothing else was working. I didn't get psychosis, also because I was given a very small amount for a short period of time, which was the one of the chemotherapy, an under control condition. Giving cannabis to a pregnant woman has serious implications for the child to be. And you in the States are the world leading expert that has conducted lots of studies on what happens to the children of moms who have been given cannabis or using cannabis during pregnancy. And this is Professor Yasmin Hurd, who works at Mount Sinai University in New York. And I highly recommend that you invite Yasmin because she's a wonderful speaker and she has done enormous amount of research, particularly on this topic. You can just get from me that is a bad news. You increase the chances of the child to have to suffer from ADHD, autism spectrum disorder, and in general cognitive delay and difficulties in by the time they are in early childhood and adolescence. So not a good news at all. In adolescence, using cannabis in adolescence is when you see the highest risk in terms of developing psychosis. Using cannabis to control nausea during menopause, there's no evidence whatsoever. You might as well drink hot water or whatever you like. I think you should discuss with a sensible gynecologist. I mean, I'm going through menopause. It would never cross my mind to use cannabis for two reasons. One, women who are going through menopause are just because of the time in life where they are, a higher risk of developing psychosis. We women have a second peak of onset of psychosis. We have, like men, the sort of late adolescence, early 20s age of onset, and then we have a peak in menopause because of the no longer protection of estrogen that for us is a protective factor for our life for psychosis. So we throw cannabis at it, not a very sensible idea. So there are suggestions that cannabis products can be useful for people with dementia. Now, there are ongoing studies, they're looking at that, and they're looking, is this the CBD, it is the THC, it is a specific combination of THC and CBD. I would wait and look for it. What we do know now from colleagues in the States, that giving cannabis to elderly people who are more likely to take also other medication might increases the chance of toxicity. So the point I'm making, don't just go to a dispensary or don't tell your mom and dad or your friend to go to a dispensary. In the States, like everywhere in the world, you have reputable physicians, and if they say, well, there is this particular study that has shown that for your condition you can take this medicinal product that's been grown under this condition and has clear indication on dosage, on side effect, on interaction, by all means you do that, because cannabis does have medicinal properties. But going to a dispensary, get a fluffy sample of cannabis and smoke it randomly to ameliorate menopause symptoms, no evidence of it whatsoever. Might as well take HRT, which on the contrary does actually have evidence-based data. You would hear people say, oh, I had cancer, I smoked cannabis, and the cannabis treated my cancer. Now, people are looking at potential treatment of some cancer condition in experimental study of animal model, again, with specific doses of THC and other cannabis compound. We don't know yet. And also, what are we talking when we talk about cannabis cancer? We know for chemotherapy as well that depending which type of cancer you have, you would have a very specific combination of chemotherapies, and you might also have biological treatments and autoantibodies. So this idea that for everything else we treat in medicine, you have very clear indication. But when it comes to cannabis, cannabis treats everything in a very sort of random way. You should be a bit suspicious of that, because I'm sure when you do go to your physician and he prescribes you a meds, you do want some information about it. So we should do the same. We shouldn't be relaxed about cannabis. If we treat it as a medicine, we should have the same standard that we have for other medication.
Anybody have any questions?
But I'm gonna have a lot.
Come up and ask your question.
Okay, why don't we go with your question, and then I can bring up slides that are relevant.
Okay,
Because I think your question are more important than my agenda, what I want to say.
go ahead. Your question.
So, I'm wondering if she said that when she had cancer, that she took pure CBD.
She was asking when you had your cancer, you had pure THC, correct?
Yes, I didn't take it. I was prescribed it.
Okay. She was prescribed pure THC. So it was a pharmaceutical grade THC.
Yeah, which is called
She did.
dronabinol. So it comes as a medication
She did.
in drops.
Yes. But it was not smoked marijuana or gummy bears. It was a pharmaceutical grade THC.
Yeah, okay, that's fine. So, but my question is, why didn't she develop psychosis?
So could you repeat again why you did not develop psychosis when you took the THC?
Because I was given very small doses only when I experienced nausea, not all day long, and for a short period of time.
What was this?
We don't have it here. It's not available here. So dronabinol. Yeah. Anybody have
But I
any-
think you might again, this is a conversation. Say one of you
Mhm.
is going through chemotherapy, or as a loved one is going through chemotherapy, and they're experiencing sort of difficult to control nausea. The person to ask is the oncologist. I mean, the person who's treating the cancer. They will know what's available and if there is a THC equivalent of dronabinol that we have in Europe. Because I didn't ask for it. It was my oncologist that said, you have tried A, B, C, and D medication. They haven't helped your nausea. Try this one. And he gave me a prescription like you would give prescription for any other medication to take. I would have my chemotherapy, and then 2 hours later, I would have 2 drops. And then that was it. And then I would have my other cycle of chemotherapy the week later, and then I would have 2 drops. So it's not that I would take it every day. It would be taken in a very specific way. But I'm sure you would be able to have, if that's your case, and I hope it's not your case, but a conversation with your oncologist about this.
Right. Yeah. But not to rely on a dispensary employee to tell you.
No.
So Marta, with your you do also clinical work. You're a psychiatrist outside of your research, and
Yes.
so when you have people, because usually as a psychiatrist, you don't go looking for patients or advertise. People come to you because they're in a crisis situation. So
Yeah.
what is the prognosis if you do find yourself, actually, let me ask first, even before you find yourself in full-blown psychosis, what are some things you need to be looking out for if you're using cannabis products?
So he said, thank you. That's a very important question. It's a little bit what I was saying. So if you begin to notice that you feel, so say you are a young person in education, or even one of my generation, you begin to notice that your performance at work or your performance at school is dropping a little bit. So you struggle to concentrate, you struggle to cope with new learning. People comment that you're not as sharp as you were before. Friends or family member notice that you're a bit more on edge, you're less keen to go out and being in mixing with lots of people or be in a crowded place, that you have become more sensitive to people looking at you, and you comment that you have noticed that people are looking at you and you wonder why they're doing that, while before you were happy to sit in the on the metro or in the bus with lots of people and would not notice if somebody was looking at you. So little changes in your behavior, in your interaction with other people, they are pointed out. This would be very important sign. And also, how would you cope with doing without the cannabis? If I say to you, have a break, take a day off, would you cope or would you really struggle? Sometimes I do say to my young patients, why don't you take a little holiday? Why don't you try to stay off cannabis for half a day? I mean, with them, I can't say a full day because it's too much of a drop, especially if some of them use quite a lot. And most of them will find it very difficult even to have a morning off cannabis. So all these things are begin to be sign that cannabis is taking over, and it's cannabis that is controlling you rather than the other way around, and having an impact on your cognitive function as well as your ability to experience reality.
Okay. Is there we've had some cases here like with cannabis and violence, and it was like a one-time use. Is that something that happens also?
So again, I don't see much of that, but I don't have the same cannabis potency you have. And as for any substance, there would be exception. So that again, there would be people who drink alcohol once and become very sick, and they might even, I mean, how many times have you had, or the young person had one night of drinking alcohol and ended in INE? Most people would drink alcohol and will take a long time to develop really harmful effects on their liver or even on the brain. So there are exceptions. There might be people who are completely cannabis naive, they use it once and they have a very dramatic effect, either in terms of violence or psychosis or both. Sometimes the violence is driven by the psychosis. If you feel that people are out to get you, you might respond in a violent way because you're trying to protect yourself.
Right.
So they are by all means exemption. Majority of the evidence suggests that it is, as I said, a regular use of high potency. But by all means, you can have people that become unwell after one or even two exposure. But I would say that that's more the exception. Things are changing with the high potency strains you see in the States, and we don't have enough study to know how frequent these exceptions are becoming, particularly in young people who have a developing more vulnerable brain. But this data hopefully will begin to come from the States. I can't do such a study because still we don't have this type of cannabis. But I certainly know from colleagues from the States of clinical reports of them seeing more and more young people who might have used once or twice and come to INE being very behaviorally disturbed, very aggressive, and very psychotic. But which is a great concern.
Right. In your clinic, you're treating people who have psychosis from cannabis. What is the prognosis if you end up in a hospital?
So the story is a good news, and I'm glad you're asking me this because we're getting towards almost the end of my time, and I want to leave you with a happy note. So in 2019, with some charity funding, now we have proper National Health Service funding, we developed this new service that looks after people who develop psychosis in the context of cannabis use. And this is again a cartoon, it is our logo created by our patients, where they want to go from a brain that they feel is now just full of cannabis to a brain that leaves space again to activity, sports, relationships, studying, and so on. And I'm just going to go to the happy news. So what we find is, by definition, This is on people who have an established psychotic disorder, which has developed in the context of cannabis use, who are continuing to use cannabis, and they come in and out of hospital, and they are more likely to relapse and have severe symptoms. And they make a decision to accept help, to make changes with the cannabis use, which could be either complete cessation or significantly reduce their use. So what this graph is showing you in red, you have all the 46 people, the very first 46 people in our clinic who completed the intervention with us. And you can see that at the start of the treatment, this is the red box, they're all well above the horizontal line that says threshold for cannabis use disorder. So they're all very well above the threshold for cannabis dependence. So they are using a lot. And you can see that when they complete the intervention with us, they are the blue line close to zero, because 73% of them are completely stopped, and the remaining small group have gone to use from every day to just once at the weekend. Does it matter? Does it make any difference to their life and their psychosis? Well, the answer is yes. So the other red box where it says baseline indicates where they were in terms of a delusional belief. So their preoccupation about the neighbors, the environment, the characteristic of psychosis. You can see they were all pretty high, and this is a clinical scale for delusion. You can see the green box that once they stopped using cannabis, this significantly reduces. To get rid of your delusion, it takes time, but these are people who who go from a clinically distressing threshold of believing that your neighbors are after you to wondering if this might be them misinterpreting and being sort of much more relaxed and not influenced at all by the concern about the neighbors. The blue box where it says SPSS on the top is paranoia. Paranoia is a key feature of cannabis psychosis. Again, you can see at the beginning it's very high. When they complete their intervention and the majority of them have stopped, it goes very low. Paranoia, by the way, is a trait in the general population. We all paranoid at some level. So paranoia is never zero. And this level of paranoia is what you would find to be normal in the general population. I mean, the red one, obviously not the blue one. And these were tangential measure that we also took. So the one with the purple box at baseline is anxiety. Again, people say cannabis is good for my anxiety. As you can see, there's lots of anxiety when they're using a lot, and anxiety goes much lower when they stop or reduce their use significantly. And actually, the change between the purple box and the little orange box is the difference between somebody being anxious enough to need to be treated for anxiety because it's quite severe, to just being anxious, as again we can be all anxious in a normal everyday life. The other one, the yellow and green, are depression. Again, we weren't expecting a change in depression. I'm not somebody who look at depression, I look at psychosis, but you can see that again the yellow box goes down into the green box when they stop using cannabis. And very importantly, these are predominantly young people. This is the other way around, because green means low level of functioning, doing nothing with their life, having dropped off school, not being able to care for themselves, to a high score of going back to good level of functioning once they had stopped or significantly reduced their cannabis consumption. And what we were also able to show is that it wasn't just a coincidence. It was actually the changes in cannabis use that was explaining, this is a statistical analysis, the changes in all the other things we measured, the paranoia, the delusion, the level of function, the anxiety, and the depression. And here are some simple numbers. 75% of them were back to education or paid work. And those who continued to use moved from daily to only at the weekend and use low potency variety. And a significant proportion of them have also gone back to study and education. So it's a very good news. So if you take cannabis out of the equation, you can really have a huge impact on the recovery chances of this group of young people, which to me is what I'm passionate about and what makes sense, gives sense to my work as a clinician. And again, here there was a video, one of them telling you his own experience, but we probably won't be able to hear it. This is an online resource that we have created for them to use. and access educational information about cannabis, video of other young people like themselves, explanation about what to do if they want to try and use. And to conclude, I just want to show you, given that I couldn't show you the video, this is an interview that one of them did with the Sunday Times, one of our main newspaper, who said, now with the clinic, I'm looking at life in a whole different way. My brain is starting to work again. I'm doing an apprenticeship and it has changed my life. And now, if you want, we have 5 minutes for question, because then my family is wondering what I'm up to on a Saturday night rather than being with them.
Anybody? Yeah, it's Saturday night. She's in London. So does anybody have any questions? You have a question. I know you have a question, right? Come on up and talk to Marta directly.
Well, I have to. What about is, he's talking about there's no studies from like hypotheses because out there they have that.
Yeah, and your cannabis is not as high potency as ours, correct?
Definitely. Yes.
What?
What steps is she taking to be able to set that?
Well, you said who is studying the cannabis that we have here? You said Yasmin Hurd, and is there?
Well, the problem with so the people that are beginning to look at what's happening with your high strain are Professor Cyril D'Souza in Yale. He's been looking at that. Yasmin Hurd, particularly Yasmin, is interested in the impact on pregnant women and the offspring and the children born from pregnant women using high potency. They're beginning to be studies. There is a study who came out this week from Canada where the potency is not as high as the one in some of the US states, but is high enough that has shown how since legalization there's been a tripling, so 3 times greater number of people developing a psychotic disorder when using cannabis. So they're beginning to be study coming from the States. I can't do them because I don't have the high potency. Otherwise, I'd be very happy to do it.
Who is she partnering with?
She's from King's College of London.
Yeah, so
I work in London, so
Yeah.
I can only tell you about London or Europe,
program.
at least in relation to my own studies.
Oh,
So why doesn't she partner with like ASU?
well, that's a huge undertaking.
Hasn't Trump stopped all this money?
It's
No.
not only that, it's an issue of funding. So
It's
you have to think in a pragmatic way. When you do funding, you need to apply for them. So being in UK and in Europe, I can apply to funding, like for instance, from a UK government. For me, it's much more difficult to apply for funding in US for obvious reasons. So it's the other way around. If when people in US ask me to collaborate with them, I do it very happily. I have to say I'm busy enough in London, although it's not as high potency as yours. I'm already busy enough, but I'd be very happy to be involved with research with colleagues in the States. If you are given again money for research, because it doesn't look likely like right now, but anyway, it's a different story. Sorry to raise this problem.
Yeah.
Wait, what was the last thing she said?
What was the last thing you said again? She couldn't hear you.
No, it was a comment on your new president that he has abolished most of funding for research at present, but or frozen them anyway. So definitely, I can't apply for funding right now to do research in USA, but I'd be very happy to collaborate on any project.
Awesome.
I have one question. So Marta, you do have, with the cannabis, you have a combination of THC and CBD. And, in some cases, it's high in the quantity of CBD compared to THC. So is there research on the impact of cannabis only CBD? It seems like that's a lot more friendly to the human body. Is that correct?
So you were saying if there is research looking at different ratio of CBD and THC, was this the question, or did I get it wrong?
That's correct.
Yes. So the person that has pioneered this research in experimental studies, so giving to human participant different ratio, has been Cyril D'Souza in Yale. And initially there was this hope that if you had a proportion of 1-to-1 of THC and CBD, like in some of the traditional cannabis, like the old-fashioned hashish of the Beatles usually had 4% THC and 4% CBD, you didn't come to particular harm in terms of risk of psychosis. And so people have become very intrigued by this and said, well, what if you have 3 times CBD and 1 time THC? Is that really actually quite good for you and very protective? So one of my colleagues has been running an experiment where he has tried different ratio with very high THC and 3 times the CBD. And what he has shown that when you have a high THC, even if you have 2 or 3 times greater CBD, that's not enough to stop the negative effect of the THC. So it is not very clear if once you exceed a certain dose of THC, the CBD can help any longer. And this is to do with the way THC and CBD work. We haven't been able to touch upon this, but the reason why we get an effect from THC and CBD is because we have an amazing endogenous system that's part of our body from the time we are actually in our mommy tummy, which is why you shouldn't smoke in pregnancy, which is the endocannabinoid system. And the endocannabinoid system is made of receptor, which are the target all over our brain and other parts of our body, and 2 main compounds that we produce who are called the endocannabinoid system because we produce them, don't come from the plant. And this system has lots of different roles, one of which is to protect our brain. In fact, majority of these receptors are on the brain cell, on the neurons. So when you, and what THC does, THC stimulates this receptor, while CBD doesn't have a direct effect on the receptor, but it modifies the way the receptor can interact with THC. The problem is that when there is lots of THC, it saturates the system. Our wonderful endocannabinoid, they're very good and do lots of good things, can't get to the receptor and do the good things they should do. And CBD loses its power to modify the receptor. So, and I'm sorry, this is very complicated, but I want you to know. But this is very important because to know that help us also to understand the effect. And the other final thing I want to say, this endocannabinoid system is not active all the time. It's not like the thyroid gland. You know, you all know that a thyroid produces hormone, and it has to produce the hormone all the time, 24/7, from when we are born until we die, or we die without thyroid hormones. The endocannabinoid system produces these 2 compounds, our endocannabinoid, only when necessary. And this, the time when this is necessary is when our brain is under distress, either because we bash our head, so we had a brain injury, or we have an hemorrhage, or we have a brain infection, or we are under lots of stress. Then the neurons produce this endocannabinoid system, which are there to reset what's going wrong. Otherwise, they're nice and at rest. So to have something like using cannabis every day, having THC coming in the brain every day, puts the endocannabinoid under constant activation, which it shouldn't be the case. And so it has an effect on disrupting the balance of lots of function of the brain in a way that we're just beginning to understand why it can be damaging and can link to psychosis. Which doesn't mean that cannabis compound cannot be used therapeutically, but this needs to be done under supervision of people who would know at least what I'm sharing with you, and with you are able to monitor for side effect and intervene before this side effect becomes a full-blown psychosis. Certainly 16-year-old shouldn't go around smoking all day because their brain is developing and the endocannabinoid system needs to be left alone. Women in menopause should not use cannabis all day long because their brain is already stressed enough by the menopause. And moms who are pregnant should leave the endocannabinoid system who's developing to keep the brain of the little ones healthy alone again. So that's a very sort of simplified, but I hope helpful conclusion.
Wonderful. Thank you, Marta. We appreciate it so much.
No, it's been a pleasure. Thank you very much. I'm sorry I couldn't be there with you in person. And I would recommend, you know, I can send you names, like if you want to invite Professor D'Souza, if you want to invite Yasmin Hurd. You have fantastic cannabis researcher in the States. And I think it would be, and one organ, actually, I don't know if I mentioned this to you. There is somebody, Laura Stark. Laura Stark is the mom of a young man who died by suicide after having developed cannabis-associated psychosis. She's based in Colorado, and she has developed an amazing charity called Johnny Ambassador in the name of her son. And she has done lots of talks all across US and the world, and she has this amazing website with a variety of information, and it's very US based because her experience is US based. I would recommend actually you invite Laura because she has lots of data on the potency and all the work that is happening in US. So I will start with sending you some names by email, and then if you need to be introduced, I'd be very happy to do that. But these are all very nice people that will say yes to you. You don't need my introduction, but happy to do that.
Okay, thank you so much for that.
Well, have a lovely rest of your Saturday day, and very nice to meet you all. Take care.
Thank you. Have a good evening.
Bye.
Bye-bye.
Thank you very much. Bye bye.